Greetings, everyone. It's a great pleasure to come to you on behalf of the VWin Foundation and in honor of Natalia Cardosa on this occasion of the Maradvance Congress in Mariana, Brazil. I'd like to discuss with you the people score. And the reason I say that is there are a lot of people that helped put this caprini score together. And these are my disclosures. One of the most important things is the power of the score. If you take a look at a 42-year-old BMI of 29 on birth control pills, caprini score three risk factors. On the other hand, a 76-year-old with a history of PE and past cancer, three risk factors. Caprini score 8. Although each patient has three risk factors, the combination of number of risk factors and their power result in a more accurate estimate of VTE risk compared to a simple list of risk factors alone. Now, another thing that's really important are the set points for highest and highest risk. And my hat's off to Kirill Lobostov and Thomas Urbanik for putting this together. They looked at 4,562 references in 4,200,000 patients. You see the score on the top, and then you see the populations. And if you look here at the line of 8 and above, and you go down, you'll see it's very low risk in medical patients. In COVID, it goes up to 28%. In cancer, it goes up to 40%, 12% over 9 and above, and then 12 and above, 40%. And the same thing for trauma and orthopedics, 15% and then 47%. And thoracic surgery the same way. Very important. And the VTE risk for individual patients increases dramatically for a score of 7 to 11. Now, family history of thrombosis is one of the frequently missed things, items, and you have to ask if there's a family history of thrombosis in all 3 degrees of relatives, as shown in this beautiful study in 2013, which hasn't really been received enough press. However, in 2024, 751,000 pedigree offspring were studied with 8 different clusters based on the density of venous thromboembolism. Very important that you ask about family history in all degrees of relatives. And the thrombophilia marker is the wrong marker because it only picks up 30% of the patients. So finally, I'd like you to remember the adage, never treat a stranger, never kill a friend, because when you meet somebody, you interrogate them so that you would never hurt them because now they're your friend. I'd like to refer you to my website with videos and PubMed citations and to the very, very valuable VWin app. I've given you also a complete set of slides since this is a very short presentation, and I want everybody in the Congress to receive all those slides. Thank you for the honor of this presentation, and I wish you a wonderful Congress.